Hello once again from the Prim Reaper. In June, I know, a little out of date, but sue me, I've been busy. CAFE, or the Canadian Association for Equality, had their national conference in Calgary, Alberta. I was in attendance, as were Allison and her husband, and several other individuals with a vested interest in men's needs and men's issues. I didn't know quite what to expect from a number of the speakers. I was familiar with a few of them, and knew that several were directly involved with CAFE, while others were simply sympathetic to their cause. However, one thing that Allison and I quickly noticed is the difference in individuals who were approaching men's mental health from a male-oriented, or at least male-supportive position, and those who were approaching men's mental health from a male-deconstructive, or male-as-problem perspective. Let me explain. Some of the speakers came from a place of accepting that men and women are different and have different means of communicating and dealing with their issues. Dr. Gans Ferrans, for example, spoke of family conflict and how men and women experience this conflict in different ways. For example, he stated that men are more likely to fixate on distress thoughts, how their blood pressure increases and remains higher for longer periods of time than women, their cardiovascular system is more active and remains at an elevated stress level relative to women's experiences. Because of this, men often remain at an elevated stress level from conflict compared with women, and this means that they will be likely to want to deal with this conflict in different ways. That is, when a woman has calmed and is ready to talk through the argument, her spouse may not be quite at that point yet and may be still emotionally walled up. He stated that being aware of these differences and acknowledging them can help men and women to work through their conflicts in ways that will be more productive and less accusatory for both parties. As you can see, this discussion comes from a place of understanding each party where they're at and working through the realities of each. It blames neither the man nor the woman, but simply suggests strategies best suited to the strengths of both parties. Another speaker, Christine Hart, I was a little hesitant on at first, since she stated that she viewed her subject through a gender lens. However, I was pleasantly surprised by the way that she approached some of her topics. Essentially, she spoke to the different communication styles of both men and women, and the ways to work around this to strengthen one's relationships. She said explicitly that we should embrace the difference between the sexes, that men are not misbehaving women. This speaker also stated that women need to have compassion for men and their way of being in the world. She said with a laugh at one point that it would be funny if we gave women male levels of testosterone and filmed it. Perhaps this would help some people understand the real differences in the way that both sexes emote and communicate. Naturally, CAFE's main speakers themselves were all sympathetic to the plight of men and spoke of their efforts to increase services for men in their respective areas of Canada. For example, one thing discussed was the difficulty in finding a suitable location to accept them, knowing what they planned to be using the building for. It's disturbing that if they were going around trying to open a women's center, nobody would bat an eyelash. But opening a center for men and families? Well, maybe you're not suited to use our building after all. Try somewhere else. The empathy gap is real, folks. However, you can see a real difference between the speakers that I just talked about and the speakers who talked about mental health from a male-as-problem perspective. In fact, I see this trend a lot in a lot of new research coming out that is talking about men's mental health. You've likely heard a few examples of this yourself. It can be pretty easily summed up in the words, toxic masculinity. In talking about suicide rates, the executive director of the Center for Suicide Prevention mentioned that the reason male suicide rates are so high is because of certain male attributes. That is, men are less likely to express their feelings or to reach out for help than women are. After all, men have been taught that stoicism and emotionlessness are the manly way to be, right? This is surely the problem that is causing all of their issues. The problem with this view is that it makes a lot of assumptions about the nature of men's ways of handling issues. Are men struggling right now because of their socially constructed masculinity? After all, these very same ways of working through their issues, stoicism, problem solving, they seem to have worked just fine for previous generations of men. Not only that, but these traits have lasted for a considerable length of time and have seemed to be quite stable or at least similar across cultures. It seems like we have much more of a complicated chicken and egg situation than what people like this make men's mental health out to be. Let me propose an alternate theory. Perhaps it's not men's way of dealing with their issues that is the problem. Maybe it's the fact that not only the helping fields, but society as a whole have begun to thoroughly disprivilege the male way of being in the world. We see this in a number of different scenarios. Rambunctious and energetic boys are treated like defective girls in elementary school. Women are given all kinds of boosts and scholarships in higher education just for being women, while standards for men remain at an all-time high. Women are told constantly that they need men like fish need bicycles, and are supported, if not outright rewarded, for kicking their spouses out of theirs and their children's lives without any consideration for how this might make them feel. And given that men's paychecks are garnished to fund their ex-wives' lifestyles, whether they remain a part of it or not, and given that their livelihoods are fully at the mercy of the word of any vindictive female coworkers, is it any wonder that some men might have some complexes about their intrinsic value? This is before we even look at the state of the mental health system in general. Frankly, we're lucky if we can get a gender-neutral focus on mental health these days, let alone one that doesn't wholly focus on mental health from a female lens. Traditional views of mental health, like cognitive or behavioral-based theories, are being critiqued as being the product of Western white male views, and feminist and postmodernist views are taking their place. Few textbooks these days don't take at least a few pot shots at the male control of psychology as a field, so it should then come as no surprise that there are few, if any, clear and concrete methods for working with and respecting the needs of male clients discussed in counseling programs these days. So tonight, we're going to be talking a little bit more about some of the particularly off-the-mark examples from presenters at the CAFE conference, and we're also going to be addressing some of the main problems that arise when we focus on men's needs from a position of assuming that something is defective within them, rather than defective in the systems that we've constructed that focus nearly exclusively on women's needs. All this and more on tonight's episode of Men's Mental Health.